Have you ever been told that you have a deviated septum? Or maybe you've heard the term thrown around and wondered what it actually means. In this episode, I will explain in relatively simple terms what a deviated septum is, how it can affect the way you breathe, and importantly, whether it could be holding back your training, athletic performance, and recovery. If you're new here, I'm Dr Guled Jama, a consultant ear, nose, and throat surgeon based in London, and I specialize in nasal airway surgery and breathing mechanics, particularly in athletes and active individuals. And in this series, my goal is to break down common nasal and sinus-related problems that affect many athletes that I see, and to give you a clear overview of the treatment options that are available that can help you breathe better and perform at your best. Let's get into it. Okay, so before we talk about a deviated septum, we need to quickly understand what the nasal septum actually is. If you look at your nose from the front, you'll see two nostrils. Inside your nose, there is a wall that sits in the middle and divides the inside of your nose into two halves. The septum is made of two main components. At the front, it's made of cartilage, the same firm, rubbery and flexible tissue as your ears, just a little bit stiffer. Further back, that cartilage merges with a thin plate of bone, and together they form the internal wall that runs roughly down the center of your nasal cavity. However, and this is important to remember, hardly anyone has a perfectly straight nasal septum. Most people have a slight bend or curve, and most of us never even realize it. So if you've been told that you have a deviated septum, you're very much not in the minority. The word deviated simply means that the septum is not perfectly straight down the middle. For lots of people, a slight imbalance doesn't cause any issues at all. However, if the deviation is more severe, in other words, if the septum leans quite far over to one side, it can significantly reduce airflow through the nostril. And this is the crucial part, when the deviation is significant, that's when you begin to notice symptoms of nasal blockage and restriction when you breathe. There are, broadly speaking, two main reasons why you may end up with a deviated septum. The first is simply how your nose develops as you grow. During childhood and adolescence, the septal cartilage and bone don't always perfectly grow in harmony. Therefore, a small curvature or bend can arise where they meet, and this is extremely common and isn't a sign that anything has gone wrong. It's simply normal individual variation, if you like. The second common cause is trauma or injury, a direct knock to the nose from either contact sport, a fall, a crash, or a ball to the face can shift or deform the septum following impact. If you've played sports like rugby, football, basketball, boxing, martial arts, or you've had a bad collision while you were cycling or skiing, this can potentially occur. And then again, in other people, it can be a combination of both. Perhaps a mild pre-existing developmental deviation that was then made worse by an injury later on in life. So how do you know if your septum might be causing a problem? The classic pattern I hear from patients is what I call the one good side, one bad side story. In other words, you may consistently find it easier to breathe through one nostril compared to the other. And there are a few common clues here. Generally, the affected nostril feels blocked most of the time, even when you don't have a cold. Or you notice you're simply breathing through your mouth regularly, especially at night. Or your partner perhaps might say that you snore or you sound blocked up in your sleep. Or when you lie down, one side feels worse, and if you roll over to the other side, it can feel clearer. Now, it's important to note at this point that having a deviated septum per se doesn't actually mean that you have a problem and therefore need treatment. What really matters is its impact and whether it's causing symptoms that may restrict your day-to-day activities when you're training or competing, for example, or your sleep quality and recovery after intense activity. Now, let's dig a bit deeper into why this really matters if you're an athlete. Imagine at rest you're breathing roughly 5 to 8 liters of air per minute, and this is the volume that your nose will shift in and out. However, once you start exercising and the intensity goes up, that volume can jump to 50, 60, or even close to 100 liters of air per minute during hard efforts. That's a huge increase in the amount of air your nose has to handle. If you have a narrow nasal passage on one side because of a deviated septum, that side is disadvantaged right from the start. Now, at low intensities, say an easy jog or a gentle ride, your nose might just about be able to keep up. However, as you push harder and your breathing rate and depth of breathing increase, that narrow side simply cannot keep up with the additional demand in any efficient way. What you then feel is a bit like hitting a wall. Your nose starts to feel increasingly tight and restricted. You develop a strong urge to switch to mouth breathing just to keep up and get enough air in. And that's exactly what many people will do instinctively at that point. They end up opening their mouth and letting all that air bypass the resistance they feel in the nose. The problem is when you breathe mainly through your mouth, especially during exercise, you skip some important physiological functions of the nose. Remember, the nose plays a key role in efficient air exchange by conditioning the air that you breathe in. It filters dust and particles from the environmental air, it warms the air to body temperature, and it adds moisture and humidity so the air isn't dry when it reaches your lungs. It also produces an important chemical called nitric oxide, which helps relax blood vessels, supporting better blood flow and more effective oxygen delivery to your tissues. In another video on this channel, I will walk you through why nasal breathing matters and how to use nitric oxide to your advantage in training. I'll add a link to that for you in the description. So, for a moment, think about the potential effects of this on your performance. If a deviated septum forces you into mouth breathing earlier than you would otherwise do, you will notice that your breathing feels rougher, that your throat gets dry, and that your overall effort level almost always feels higher than it should for a given pace. And if you're an endurance athlete, that relative inefficiency in breathing economy and gas exchange can significantly add up over time and become problematic. Now, I want you to understand at this point that nasal blockage when you exercise doesn't always necessarily mean that a deviated septum is the sole cause. In fact, there are broadly speaking 3 main mechanisms that can contribute to nasal obstruction during exercise. I talked about these in more detail in a previous episode, so if you haven't watched that video, make sure you do. I'll put a link to that in the description. But to provide you with a brief overview, and remembering of course that this is not a personal medical diagnosis, but rather a framework to help you think about what might be going on. Firstly, if your symptoms of nasal blockage fluctuate, in other words, they come and go, or they're linked to certain times of the year or certain environments, or they're clearly worse with exposure to, say, pollen or dust or cold air or strong smells, then rhinitis, meaning inflammation of the nasal lining, is likely an important part of the picture. However, if you feel that one side always feels worse day after day, year after year, and nasal sprays only help very little or not at all, then a structural issue such as a deviated septum could be contributing to your problems. On the other hand, if you feel okay at rest, but during hard efforts your nostrils seem to pinch in or collapse inwards on one side or sometimes both, and you find that nasal strips make a noticeable difference, then perhaps you may be experiencing what is referred to as dynamic nasal valve collapse. So if you're an athlete or a physically active person and you recognize some of these patterns, here are a few key questions to ask yourself. Do you always feel like one nostril is more blocked than the other? Do you find yourself giving up on nasal breathing and switching to mouth breathing relatively early in a training session or a race? Do you have a history of a broken nose or an injury to the face, perhaps when you were younger? Have you tried nasal sprays consistently and they only help a little or not at all? If the answer to several of these questions is yes, then a deviated septum could be playing a significant role in your symptoms, perhaps even alongside other contributing factors such as rhinitis. The good news is that once we've correctly identified the main mechanism behind your symptoms, we can usually do something helpful about it. For structural problems such as a deviated septum, there is a well-established and effective surgical treatment option called a septoplasty, which is designed to straighten the nasal septum and to open up the nasal passage on the narrow side. For many people, including athletes, that can make a real difference to how easily they can breathe through the nose, both day to day and during exercise. In other videos, I talk in much more detail about septoplasty and other surgical options, including what the procedure involves, the intended benefits, possible risks and recovery, and what kind of improvements you can realistically expect. So feel free to explore those on this channel if you'd like to go deeper. So by now you should have a clearer picture of 3 things. First, what the nasal septum is. Second, what we mean by a deviated septum. And third, how a deviated septum can make breathing, especially during exercise, feel inefficient and more restricted. If you found the information in this video helpful, I would really appreciate it if you could consider subscribing to this channel. I'd also love to hear from you in the comment section. What's been your experience? How does nasal obstruction affect your exercise performance? Do let me know what specific topics or questions you'd like me to cover in future episodes. Your feedback generally helps me plan educational content that is most useful for you, and it also helps other athletes discover clear, evidence-based information so they can make better decisions about their health and find reliable answers to help them breathe better and perform at their best. Thank you for watching, and I'll see you in the next one.